Deputy Welsh, and now call Deputy Kevin Humphreys. It's 5 minutes.
Thank you, Chair, and thank you, Chair, for facilitating my participation in the debate this evening. Chair, it actually just struck me when Deputy Flanagan was making his contribution about the whole area of buy one, get one free. And at that time, the gallery was full of young ladies. And often that's the very market that is exploited, because it will enhance their good looks. They sell a product wrongly to convince, and it is mainly young women, to go under sunbed treatment. And it is a treatment, to burning your skin, to change your colour, that in theory makes you better looking, feeling better about yourself, etc., etc., in a marketing ploy. And I think it's good today, when the debate was going on, and many times there was different school classes that were in, and mainly young women that could hear the debate and to hear the whole seriousness of it. Because certainly when I was their age, I never thought about cancer. I never thought about the serious effects it has. And I think every family has been touched by that horrible C word when the investigation has been carried out, and they arrive in and the curtain is pulled back and you're told you have cancer. And unfortunately, I was one of those people many years ago that I was told I had cancer at very short notice and then had to go under surgery. And a little ironic in many ways is Dr. Crown entered the Senate the same time as I entered the Dáil, who was my doctor and who treated me right through 8 months of chemotherapy, successfully, as may see at the moment.
Saved you.
But not all families come through that. And many times when you're going through the treatment, you don't necessarily think of the effects that has on a wider circle. That immediately affects your wife, your children, your mother, your brother and sisters. And this is what's been sold. And it's been sold to mainly young ladies in their early 20s, come in and get it under the sunbeds, put your skin into an oven, little bit like a chicken, get it burned, and then 10, 15 years later, you get diagnosed with cancer. Now, is it really worth it? Is it really worth to have a little bit of brown skin, to look well at your debs, to look well at your wedding day, and then possibly not see your children grow up? Because melanoma cancer, as the Irish Cancer Society continuously points out, is a killer. So when we talk about sunbeds, we're playing Russian roulette. And for Irish people, the odds are stacked against you, because we have that bit of fairer skin. We're more prone to it. And you heard other deputies reading out the statistics. And they're the cold figures that Irish people are more likely to get skin cancer than many other European countries. And that's fact. And that's why it's very much I welcome this bill today. I don't want many other families to go through what my family went. I don't really want to see any woman, because she wanted to have a lovely colour at our debs or a lovely colour on the wedding day. Is fashion that important? And I think the more we speak about it, and I don't think the importance of the bill in itself to control and regulate sunbeds, it's actually the discussion. It's to highlight the impact this has on our families and on our friends. And if you go up to Elm Park and you talk to anybody, and there was one woman that was when I was going through my treatment from Carlow with three young children. 10, 15 years after they'd done sunbeds. If they were warned, or if the regulation was in then, as we had proposed now, many lives could have been saved. We have a responsibility not just to bring through regulation and legislation, but that responsibility to do is to openly discuss the dangers and to make sure the safeguards are put in place, that in the middle of a young woman or young man's life, when their families are young, that they would have to go through the whole traumatic experience of chemotherapy and surgery.
Thank you, Deputy.
Chair, thank you for your time and thank you for the opportunity to debate this today.